Erectile dysfunction, ED, commonly referred to as impotence, is a medical condition characterized by the consistent or recurrent inability to attain or maintain an erection sufficient for satisfactory sexual performance. While it is not uncommon for men to experience occasional difficulty with erections, persistent issues can indicate an underlying health problem that needs treatment. ED is more common with age but is not an inevitable consequence of aging. It can significantly affect a man's quality of life, emotional well-being, and intimate relationships. Causes of erectile dysfunction. ED can result from a variety of physical, psychological, or lifestyle-related factors, or a combination of these. Understanding the root cause is essential for effective treatment. Physical causes. Cardiovascular diseases, conditions like atherosclerosis, hardening of the arteries, can reduce blood flow to the penis. Diabetes, high blood sugar can damage nerves and blood vessels that control erection. Neurological disorders, Parkinson's disease, multiple sclerosis, and spinal cord injuries can interfere with nerve signals. Hormonal imbalances, low levels of testosterone or other hormone irregularities may contribute. Obesity, excess body fat, especially around the abdomen, is linked to ED. Medications, drugs used to treat high blood pressure, depression, or prostate conditions can cause ED as a side effect. Psychological causes. Stress and anxiety, work-related or financial stress can impair sexual performance. Depression, mental health disorders can reduce libido and lead to ED. Relationship problems, poor communication or unresolved conflicts with a partner can affect sexual function. Lifestyle factors. Smoking, damages blood vessels and restricts blood flow. Excessive alcohol use, can impair the nervous system and affect erections. Lack of physical activity, contributes to poor circulation and other health conditions associated with ED. Poor diet, high cholesterol and high blood pressure, caused by unhealthy eating, are linked to ED. Symptoms of erectile dysfunction. The main symptom of ED is difficulty getting or keeping an erection. However, other related symptoms may include reduced sexual desire, difficulty achieving orgasm, anxiety related to sexual performance, feelings of embarrassment or low self-esteem. These symptoms can develop gradually or occur suddenly, depending on the cause. Persistent symptoms warrant medical consultation. Diagnosis. Diagnosis of ED typically begins with a detailed medical history and physical examination. Doctors may ask about duration and nature of the erectile problem, psychological factors like stress or depression, lifestyle habits, example smoking, alcohol use. Additional tests might include blood tests, to check for diabetes, hormone levels, and cholesterol. Urinalysis, to detect signs of diabetes or other conditions. Ultrasound, to examine blood flow to the penis. Nocturnal penile tumescence, NPT, test, measures erections during sleep. Treatment options. Treatment depends on the underlying cause and severity. Common approaches include lifestyle changes, quitting smoking, limiting alcohol, exercising regularly, eating a balanced diet, managing stress through meditation or therapy. Medications. Oral medications, PDE5 inhibitors such as sildenafil, Viagra, tadalafil, Cialis, vardenafil, Levitra, and avanafil, Stendra, increase blood flow to the penis. Hormone therapy, testosterone replacement if low levels are detected. Alprostadil, available as an injection or suppository for direct application to the penis. Devices and surgery. Vacuum erection devices, pumps help draw blood into the penis. Penile implants, surgically placed devices that allow erections. Vascular surgery, rarely used, considered when there is a blood flow problem due to injury or blockage. Psychological counseling. If the cause is mainly psychological, therapy with a counselor or psychologist can be beneficial. Couples therapy can also help improve intimacy and resolve relationship issues. Prevention. While not all cases of ED are preventable, healthy lifestyle choices can significantly reduce the risk. Key preventive strategies include maintaining a healthy weight, managing chronic conditions like diabetes and hypertension, avoiding tobacco and excessive alcohol, staying physically active, reducing stress and getting adequate sleep. Conclusion. Erectile dysfunction is a common but treatable condition that can stem from a range of physical and psychological causes. It is important not to ignore the symptoms, as ED can also be an early warning sign of more serious health problems such as heart disease. With proper diagnosis, lifestyle changes, and appropriate medical treatment, most men can find an effective solution to regain sexual function and improve their quality of life. Open communication with a healthcare provider and, when needed, a mental health professional is key to managing and overcoming ED.